Hello, I'm Daniel, and we're going to talk about coronavirus today. It's not a very fun thing to talk about. It seems like that's what this page is used for mostly, and I want to get away from that, but stuff keeps happening, right? So it's hard to get away from that. So, coronavirus, I want to share good news first, and that is last week I contacted the facilities department and I told them, hey, the hand sanitizer is out basically all the time by the elevators. It's running out too fast. We need to do something. And they told me they're bringing in giant hand sanitizer dispensers, like the giant ones you see in stores sometimes, where it's not like a little thing bolted to the wall, but it's a big thing. It's big and tall, and it's got lots of sanitizer in it. So that's good news because we'll run out less, hopefully. So that's the good news. Hand sanitizer is going to come. It's going to be helpful. But of course, that's a little thing to deal with this problem, right? And I want to talk about some IRS employees have died of coronavirus. I'm not going to be dishonest about that. Some have. I can't tell you how many. I can't tell you where they worked. I can't tell you anything about them except that it has happened. And that's pretty alarming. I don't think they got it at work, but at the same time, I don't know that. One thing we've discovered recently, discovered maybe isn't the right word, but I just want to tell you, this is a story. An employee came to the union and told us, hey, these 3 people that got coronavirus, they all were on the same team and sat in the same row next to each other. And we didn't know that because if upper management is doing contact tracing, if upper management is looking at these trends, they're not sharing that with us, which is horrifying. But I just want to say that the information on this page goes 2 ways. It goes 2 ways. So I share information with employees and, we say, oh, this employee was in this department and they were last in the building at this time. And I know that information is really helpful, but employees bring a lot of information to me. Somehow employees tell me, hey, they told us to get ready. They're closing our department, like way before management tells us that there's been a COVID case. So this page is really useful for that. And I want you to think of this page as ways we can help each other, because the truth is that we're a union. We are working together. I know I'm hesitant to bring this up, but I know some people think I'm paying dues. What's the union doing for me? And we are doing things together. I'm paying dues too. Everybody pays dues. But we're doing things together. It's not always about what the union can do for you. That said, if you get in real trouble, you get representation from the union, and that will help you a lot. But also, we're being part of something, and we're working together to try to make a better situation for ourselves. And it is hard sometimes, and it is really hard sometimes, and I know that. And we do pay these dues, and sometimes it really sticks with me when people say the union's not doing anything for me. That really sticks with me because we're trying very hard. And the truth is that sometimes an employee needs help and we can't help. But my goal is to make sure that employees feel heard and feel that we care. And if they don't feel those 2 things, I want to know about it too. So I do want to say that if a steward has treated you badly, made you feel like they don't care, made you feel like they're not listening, you come and tell me and I will do something. All of that being said, management tells us they're doing contact tracing in the building. And by management, I do mean upper management. I don't mean your friend who's your frontline manager. I have to make that disclaimer because sometimes people get upset when I say management is a management's doing bad things. It's not your frontline manager. It's way above at the top. But so upper management is telling us they're doing contact tracing. And they're telling us that all the areas are getting cleaned. And they're telling us a lot of things. And what I would really like is to be able to do contact tracing myself. So I would really like, and I've asked this before, and maybe I'll keep asking it, but what I would really like is for people that have coronavirus to contact me so I can ask them questions. And I understand that is a scary thing to do. I understand that, because if the word gets out that you have coronavirus, a lot of people are going to have questions like, why'd you go to work with coronavirus, right? And the truth is that a lot of people have no symptoms at all, and they suddenly find out they have coronavirus. And we've seen a lot of cases where, like, this person has coronavirus and they haven't been to work in 2 weeks, right? We've seen a lot of cases like that. So there are lots of things to this. I had a medical procedure and I had to get tested for coronavirus. I didn't have any symptoms, and I did test negative, but I could have been one of those asymptomatic people, and I could have tested positive and been like, oh my God, I can't believe it, right? And I think that is, with some of these cases, I think that is what's happening. So a very helpful thing would be if people with coronavirus reached out to me. Only a handful out of the 40-something that we have had now, only a handful have done that, because for a lot of reasons. There's a lot of reasons not to do that. And I do understand it. And I wouldn't shame anyone for not wanting to share that medical information with us, but it would help, because we're trying to figure out what's happening. And another thing I want to say is, it bothers me a great deal that there are people in upper management making these decisions about what should happen in the building, and these decision makers are working from home. It bothers me a lot if someone working from home is deciding how much contact tracing needs to be done in the building, and how long an area needs to be closed, and how much cleaning needs to be done. That bothers me a lot, because they're not there. They're not there. And we're trying to get them to come have meetings in the building, and we'll see if that works. But that's what I would really like, is to have a meeting with some of these executives in the building in person and talk about the safety of the building. I would like that a lot. And we are trying to get that to happen. And different IRS centers are handling this to varying degrees. And some of the problems we're having in Kansas City are happening at all the service centers, and some of the problems are just happening here. And I can tell you that the IRS is hearing the name Lori Mings a lot. And our high-level union people are hearing the name Lori Mings a lot, because we need to talk about her. They need to hear about her and about what's happening here. And we are in talks to consider putting together a campaign to have our members reach out to the Missouri Department of Health and the mayor and, the CDC, anybody else, just to have this get reviewed. And our representatives as well, because we could contact them, because we're government workers. And so we're looking into doing that as a next step, because what is happening in our building is embarrassingly bad, right? I think my biggest concern is I think contact tracing is not happening. And I believe they are not cleaning the elevators when there's a COVID case. And that is a button that you press with your finger, right? Unless you do the elbow thing. That's what I do. I do the elbow thing. If I'm not taking the stairs, I'm usually taking the stairs. But I'm in an elevator, I'm hitting it with my elbow. Because, man, you touch that button and then you touch your face, So, I think the elevators, that should be thing one they clean, maybe. But I believe they're not doing it. I believe they're not doing it. If you see a guy in a hazmat suit in an elevator cleaning it, let me know. But I don't think that's happening at all. And that bothers me. I'd like to get temperature checks in the building. They told us that's a non-starter. That's not going to happen. They don't want to pay someone to do that, I guess. I don't know. I would like that. Like, you come in the door, you get a temperature check. I've heard of businesses doing that. I've gone to the doctor's office and they do that. We're not going to get that. None of the IRS centers have that. So it's unlikely we will get that. Our efforts in that area aren't working. But my wish is that we can get some serious contact tracing to happen so that at the very least we know if someone caught it at work. At the very least. I feel like if someone caught it at work, they could have a lawsuit. Maybe. I don't know. But another thing is, I hear stories, people come and tell me about, oh, I see these people putting tables together and sitting together in the lunchroom, like 7 of them, and they take their masks off. And look, that's alarming to me. And I think you should report that to your manager. And if your manager doesn't care, tell their manager. I don't know what else to do about that. The union does not get employees in trouble. The union does not get employees in trouble. My advice is stay away from the cafeteria. What are people even doing going there? That's what I think. I think the cafeteria and the store for the next few months should be places to be avoided. Because it's a pandemic. Come on, people. But that being said, if you see somebody walking around without a mask, you can tell your manager. I don't know what else you can do. I have been told, I keep hearing that management, some teams have managers that are kind of strict about it, and they see you without a mask and they get on you. In other areas, like, it seems like nobody cares, and that's alarming too. Masks do slow the spread of the virus, so they really help us protect each other, and protecting each other is what this is all about. And as a final note, I do want to talk about weather and safety leave. Well, no, I don't want to talk about it, but I need to talk about it. Weather and safety leave. I know there are plenty of people who are working in the building every day, and they hear about, other people on weather and safety leave who aren't working at all, and they think, man, that jerk, right? They think negative things about them. And the truth is, are there people abusing weather and safety leave? Probably, right? I think less now than there were a month ago, but there probably are people abusing weather and safety leave. Going on vacations, partying, whatever, hanging out with friends, whatever. My feeling is if I had cancer or COPD, I'm not leaving my house during this. But that said, we don't know somebody's story. That's number one. We don't know somebody's story. We don't know what they have. But yes, going on a trip, if you're on weather and safety leave, yes, of course that bothers me. I don't like that at all. And if that's happening and you know about it, that means what? They're being public about it. That's a mistake they're making, because it's coming. I think that anybody goofing around is going to be removed from weather and safety leave in short order. But actually, I also think this might not be being handled in the best way possible, because their efforts should be to catch people abusing it and not just hit it with like a hammer and remove as many people as possible, which seems to be what they're doing. And the reason I say that is because I heard about an employee with cancer who was removed from weather and safety leave. And I think that's what I'm thinking of when I think of, do we need weather and safety leave? I think about that person with cancer who will die if they get coronavirus. I don't want that person to come to work. I do want the IRS to take care of that person and keep that person at home and not make them use their leave. I absolutely want that for that person with cancer, for that person with a severe respiratory illness, right? We want to protect that person, and that's who I am thinking about. I am thinking about, oh, if that person catches coronavirus, they're going to die. I'm thinking about life and death, and I'm not thinking as much about some jerk who is partying on the government's dime, who is just taking a free ride. I'm not thinking about them very much. And the truth is that if 5 or 6 or 10 people are abusing the system for every one cancer victim that gets to stay at home, I don't lose sleep over that. And I know people do, and I know we can be very bitter and upset about what's happening, especially when the people in the building are not getting the safety we would like. Then it can be very easy to think about somebody abusing weather and safety leave and staying home and being safer. And I know that, and I'm sympathetic to that. And I do think that, though, that train's going to end, and anybody abusing weather and safety leave is going to get in real trouble. And I honestly think the people with really deadly conditions, they're going to come back to work before they should. And that's who I think about, and that's who I'm worried about. I personally called a widow, a woman whose husband died of coronavirus. And so I know this is scary. It's scary and it's horrible, and our agency is not doing enough. Our agency is not doing enough. I think they should do public addresses like this, and I think they should convince employees they're doing a good job. I think that should be something they do. And they're not. They're far away from doing that, right? They send emails. They send emails and say, hey, stay safe, follow CDC recommendations. Well, that's not what we need, right? We need leadership. And we need the agency to convince you that you're safe. And an email's not going to do that, right? And I think that is on them to do that. What I would really like is for some IRS executive to do a public address and convince you that that building is safe. That it is safe to come to work every day. That it is safe to do this crazy thing of moving employees from infected areas to other areas. Somebody's going to get sick that way. Somebody's going to get sick that way. That, to me, that is the worst thing. Of all the things being done, to me, that is the worst thing. Moving people at all. You either send them home or you don't. That's what I think. And I cannot believe it the first time I heard about that. I could not believe it. Like, we know coronavirus has been here, so we're going to move you over there where it hasn't been. What? It's a disaster waiting to happen. So, I have rambled on quite a bit. This is a tough time, okay? And we need to be together on this, because the truth is we're all being mistreated. And the employees working in the building, I really want to get you hazard pay. And I'm going to bring that up at every meeting always, because hazard pay or some other kind of benefit, I don't know what else they could offer, but hazard pay would be awesome to where it goes back to the whole time you've been in the building. Wow, right? Even if it was a really small amount, it would build, and it would be a really great thing for you. But if we can't get that, the least we can get is contact tracing and stop moving infected employees, right? That's the least they can do, in my opinion. So that's it. We are going to try to get an in-person meeting with some IRS executives of our building, and we'll see if we can. I feel like some excuses will come out, but we'll see. So everybody, please stay safe. Any questions, send a message to me, ask me. Send a message to the page, ask the page. This is a tough time for everybody, and we are all just doing our best, okay? So thank you for taking the time to listen to me. Have a good day.